Please remember that is your pericarditis. So what is that pericarditis? Patient have that substernal pain and it can radiate to the neck. And you know what is pericarditis? It's just inflamed pericardium. Okay, inflamed pericardium. But this is not a anatomy question. So, but patient have inflamed pericardium, and patient will have that substernal pain. It radiates to the neck or left arm. But just use this to remember it. Pericard pain. They have substernal pain. It is exacerbated by lying down. So E is exacerbated by lying down. R is it radiates. We said it radiates. It radiates to the neck, to the left arm. C, patient have that sharp chest pain. A, it is alleviated by sitting or leaning forward. Very important. Leaning forward. Then D, patient patient can have a D, which is that deep breathing. It makes it worse. And R, they have that friction rub or rub. Just say RUB, rub. P, they can have that pain, that sharp pain. A is aggravated when they are lying down, supine position, lying down flat. It improves with when they are sitting or when they are leaning forward, and the treatment is NSAID. And also remember the sitting up. So you can use Pecard pain to remember your pericarditis. Very important. Then another important thing is angina. Angina is high yield in the exam. And the angina, you must know we have three types of angina. So what is that angina? Angina, you can just say is a chest pain. When somebody say I have chest pain, so that is angina. So patient present with chest pain, that is angina. So you can just call it a chest discomfort, and it's always as a result of a reduced blood flow to the heart muscles. So sometimes it's a symptom of somebody having a coronary artery disease. Okay. So, but what you need to know about angina is that angina, it is three types. So the first type is the stable angina. So what is that stable angina? Stable angina is predictable. It is predictable. So it is always triggered by exertion or stress. So let's say patient have stress, or patient is walking, or patient is, it has to do with activity, but it is relieved with nitroglycerin, or it is relieved with rest. So when patient rest, they feel better. So that is stable angina. Then we have unstable angina. So unstable angina, this person already have angina, but now this angina may be becoming worse or frequent. So let's say patient was previously diagnosed with angina, okay, but and it has changed, maybe because the duration of the pain have changed, it is worsened now. So now rest and nitroglycerin is not going to help. So you're going to send this person to ER. Know when to send your patient to ER. Know when to refer your patient. Then the last but not the least is your variant, also known as Prince Metal. Very important. Prince Metal. So this is the one that is always caused by coronary spasm. It's always caused by coronary spasm. And another important thing here is that it's always caused by coronary spasm, and also you should remember that it can happen. It can happen at rest. It can happen at rest. It can happen when they are sleeping. So this sleep here, don't think it's just there for this thing. It happens at rest. So this is the one that is caused by what? We say that is caused by coronary spasm. That word is very, very important. What type of angina is caused by coronary spasm? That is metal. Metal. So everything I said is just for emphasis. It's here. Stable angina, predictable, a trigger by exertion or stress. Unstable, patients have new or worsening. So they may have previously been diagnosed with angina, but it is worsening and it's not relieved with rest. So send them to ER. Then you have your metal or variant. This is the one that we say that is caused by coronary vasospasm. So everything. Then what are the classic sign of this? They always present with that chest pressure, tightness, and patient is going to have pain radiating. It radiates to the jaw, it radiates to the arm, it radiates to the back. So everything I'm saying is still the same thing, just for emphasis, radiating to the back. Then another important thing here is patient also present with shortness of breath. So what are the treatments? Some we already said depending on the type of angina. If it's the type that they need to go to the hospital, you need to send them to ER. Okay, if they are not going to get relief with nitroglycerin and rest, so ER. Then they can also get beta blockers. They can get calcium channel blocker. Calcium channel blocker, especially for your metal, because it's caused by what? It's caused by coronary vasospasm. I've highlighted that point so many times. So that one, which is the metal, is right here. Calcium channel blocker, like verapamil, calcium channel blocker. Unstable, they can go to ER. So very, very important. They can go to ER. So please know that they can